Hello everybody, this is Dr. Kalpanasringar from Prakruthi Charitable Foundation. Welcome to my channel, Tuning a Fragile Mind. Last time I briefly explained about how you could identify different types of mental disorders. Today let me tell you what exactly psychosis means. Psychosis could be a thought disorder or it could be a mood disorder. Today I am going to just talk about thought disorder and most of the symptoms that you come across in schizophrenia. This being a thought disorder, people who are suffering from such a thing will not understand what is real and what is not real. There's a total confusion. There's a total distorted view or perception about what is real and what is not real. Now, what are the causes? And do you see this in the population? Do you see many people suffering from it? The answer is yes. You see about 1 million cases in India alone per year. These people have a lot of problems. The age of onset would be somewhere between 20 and 30 years. Men and women both get affected by it. And if you see children, a few children under the age of 13 also could get such a problem. This particular illness needs a lot of care and treatment. If you don't treat these people, they go haywire. They can never become normal or they can never become functional. Now, what could cause this problem? When I say that 1 million people in India alone could be suffering from psychosis, what are the main reasons for it? One reason that everyone knows is heredity. It could be genetic. It could come from generations. The other could be environmental. There could be some precipitating factor. Something from the environment, maybe a lot of stress, that could cause psychosis. There are people who are on prescription drugs, people suffering from tuberculosis, people suffering from leprosy, people suffering from Parkinson's. All these people are put on very high dosage of medicines. These people could also exhibit psychotic symptoms. And people who are taking these recreational drugs could also exhibit psychotic symptoms. And the other reason for getting a psychotic episode could be a lot of stress. Now, what are the things that you see in people who have psychotic features? What are the different stages that you see? In the first stage, it becomes very, very difficult for a family member to identify that a person is suffering from psychosis because he could be exhibiting a little bit of behavioral changes or mood changes. And the family members, because of lack of awareness about the disease and so much of stigma attached to it, they may just neglect it and say that, okay, maybe he's not in a good mood. But that slowly starts developing. By the time it develops, the illness could have taken a long time, and when the medication is started, it would have already reached a higher stage. Cognitive deficits could have already set in, and treatment becomes a little more difficult. This stage, we call it the prodromal stage. After this stage, they go into an acute phase where they have delusions. Delusions could be of a persecutory type. Delusions could be of a grandiose type. When I say persecutory type, they may feel that somebody is standing behind them, somebody may stab them. These are called delusions of persecution. In a grandiose type of delusion, they may feel that they are above everyone. They are gods, they can do this, they can do that, they can control the universe. So this is a kind of delusion. And then they could also have hallucinations like auditory hallucinations. They could be command hallucinations, wherein they get a command, come on, you jump from the first floor and kill yourself, commit suicide. Do this. Try to throttle the neck of this person. They may hear a lot of voices. And these are auditory hallucinations. Some of them can see visual images. They can see another person standing there and trying to accuse him or her of something when they're not there. They perceive different things. They see so many sorts of visual images. They may even complain, come on, yesterday I saw this person trying to attack me. For them it looks real. They're confused with reality. They do not know what is real and what is not real. So, and some people may feel that there's something crawling all over their body. That's also a kind of hallucination. So how do we help such people? Don't you think they need help? Don't you think they need to go to a professional and seek help? It is duty of the family members or friends to help such people come out of this illness. The whole problem is, when they're not treated, they end up with a lot of cognitive problems. They cannot go to school, they cannot go to college, they cannot work in any place constantly. They start quitting jobs. They will be absolutely amotivated to do anything. And especially people with schizophrenia who show signs of positive symptoms, they'll have all these florid symptoms of hallucinations, delusions, mood changes, and a lot of disturbance with regard to sleep and appetite. But when you come across people with negative symptoms, they just sit in a corner of a room. They don't like to communicate with anyone. They just sit quietly. They show withdrawn behavior. They do not want to interact with anyone. Their personal hygiene would be bad. They may tear off their clothes. Such things. It's very difficult to treat a person with negative symptoms. You can treat a person with positive symptoms more easily than treating a person with negative symptoms. I can give you an example of a patient who came to us long ago who showed positive symptoms. He was a young boy of about 20-21, and this boy would tear off all his clothes, walk naked at home, urinate on everyone, and he was not brought to the hospital for more than a year, though he was exhibiting such kind of behavior. But he was only brought to the hospital when he said he's a messiah who can control the whole universe. That's when they thought that something could be wrong with this fellow, and they got him to the hospital. But of course, he being a very young boy, he came out of it because of medication and psychotherapy, and he was rehabilitated. He's doing very, very well now. But of course, when I say very well, the residual symptoms will remain. It doesn't totally erase or eradicate the illness. A few residual symptoms will remain. So to control these residual symptoms, they need medication. They need constant psychotherapy, wherein they develop an insight into the problem and feel that, yes, I need medication, I have this illness, and I need to come out of it. So when they are treated with medication, when they are given a lot of psychotherapy to develop an insight into the problem, and when the people of their family are educated about what this illness exactly is, and how to go about treating such a person, and how to support him at home, how to be kind-hearted and not think that he or she is doing things purposely, it becomes easy for the person to come out of it. There are many families who show a lot of expressed emotions. We label them as expressed emotion families because they always complain. They said, this fellow did this today, he did this today, he's not coming out of it, we are fed up of him, we just want to throw him out of the house. See, these are all families which we categorize under expressed emotions. And if you come across such a family, you should psychoeducate them and tell them no, he's not doing it purposely, it is something because he has such an illness. And believe me, unless and until these people are treated, they will never come out of this problem. Treatment is very, very essential, and rehabilitation is a must. Unless and until there is rehabilitation, they can never become functional. And functional in the sense they can go back to their work, they can do their normal chores every day. Because they're on medication and they're given enough support from the family, things become very, very easy. So we at Prakruthi Charitable Foundation get a lot of such cases who suffer from schizophrenia, a part of psychosis, and they come here for daycare. They stay from morning till evening with us. We teach them certain vocational skills. We train them so that they can stand on their feet. We try to eliminate stigma, and we psychoeducate the relatives. We tell them what is good and what is bad and how they have to treat these patients. So in case you come across such people, have sympathy and get them to the doctors, or we are also there to help them from our foundation. And it's always very nice, and it gives you a lot of happiness when you see some person coming out of their mental issues. So thank you so much, and in the future you'll see many more episodes of various types of mental illness. So keep watching our videos. Thank you so much.